over the next 12 months, we are going to be working hard to look at the local plans that are coming back from sustainability and transformation partnerships and making sure that they are really ambitious for mental health and that they will together add up to what we've nationally committed to for mental health. So that's a particular priority for me over the next few months because local areas are working hard on those plans now. So I think that's probably for this year the biggest thing, is setting that plan out locally across the country. So I think there are three areas probably that I'd like to highlight. I think the biggest area of transformation that we need to see over the next 10 years is for services for people with severe mental illness, and it's really exciting that we saw more than £1 billion of cash committed in the long-term plan for that transformation. So I think for the next 10 years that's really exciting piece of work. I think the second bit is something where we've already started to see some transformation, and that's in services for children and young people, where we are able at the moment to see around a third of children and young people who need it, which is clearly not enough, and we need to do much more over the next 10 years to meet the needs of our children and young people. And I think the third really exciting area over the next 10 years is seeing how the commissioning landscape transforms, not only for mental health, of course, for all of health, but I think mental health's got a key role. And one of the really exciting bits of work that we are doing is with new provider-led collaboratives who are taking on commissioning responsibility for their local populations for specialised services, and I think they can play a really key role in bringing about fantastic improvements for people in terms of their patient experience. Some of the people who are the most ill and who need access to the most specialised services will be able to get that care closer to home in the community with shorter lengths of stay, which I think is fantastic. So as you will expect, I think it's very important. I think we are going to see the truth of that when we look at the local plans that come back over the next few months to see where mental health has landed. Has it got such a high priority as we've given it nationally? And it will be a really important sort of test. And I think, as I've alluded to already, I think mental health has got a fantastic role to play in the development of integrated care systems. So I very much hope and expect that mental health will be a leading light in the emergence of integrated care systems, perhaps building on the work of our provider collaboratives. And of course, patients who have poor mental health also have other health needs, and it's really important that those are met together. And I think emerging integrated care systems and the bringing together of all the priorities in the long-term plan are important for everyone, but especially for people with poor mental health. So I really enjoyed the panel session that I was a part of. Of course, I'm not trying to blow my own trumpet, but I really enjoyed the other two panelists' presentations who I was with, and it was fantastic to have such an engaged audience asking some really insightful questions at the end, which were challenging enough for me, but also really exciting to hear the work that's going on in local areas.